So as I said, my name is Shirley Dominguez. I am a healthcare navigator through the marketplace with Epilepsy Florida since 2014. I have been from the moment they pretty much started in year 2. And right now we are in open enrollment. So it's very busy out there, and we want to make sure that all of you understand and make sure that you take the opportunity to speak with one of us. If you are in Okeechobee County, Indian River, St. Lucie, Palm Beach, Broward County, Miami-Dade County, and Monroe County, please give us a call at 877-553-7453. And that way you'll be able to understand and make sure that if you qualify for coverage, you may be able to afford it. And I'm letting you know that with all the breaks that our government has given, and with the American Rescue Plan, there is a plan out there for you. So we want to make sure that you understand what you're looking for. I will want to introduce, and just to make sure, if anybody wants to hear this in Spanish, there is an interpretation button at the bottom of your screen. Please just select that. And we do have one of our other lead navigators, Giancarlo Alfano. I'll let him introduce himself also. He will be interpreting the slides for you and any questions that you may have in Spanish. We do have other lead navigators on this presentation for you. We have many of our staff that have been out there in the counties and making sure that you understand that we are here to help you. We are here to understand you. We are here to educate you. So let's get started. Giancarlo.
Hola a todos, buenas noches. Mi nombre es Giancarlo Alfano, como Shirley comentó, soy un navegador también de Epilepsy Florida. Ahorita, pues, que es el periodo de inscripción abierta para todas las personas que se quieran registrar. Estamos, pues, disponibles en español también. Presentamos servicios también en inglés y en criol. Estamos ahorita, pues, preparándonos para hablarles un poquito sobre todo lo que hacemos dentro del programa de navegación de Epilepsy Florida, ayudarles un poquito más a entender sobre el seguro de salud, cómo ayudarlos a hacer una cita con nosotros para que de forma gratuita podamos asistirles llenando la aplicación para lo que es conocido como el Obamacare.
Y si necesitan asistencia o quieren escuchar en español, por favor, hunden el botón en la parte de abajo de su pantalla, donde es un botón verde que dice interpretación o traducción en español. Hunde allí y ustedes escucharán a Giancarlo. So let's get started.
Una nota rapidita. Hola, estoy con Carlos Miami. Si quiere oírlo en español, por favor indique en el chat y te vamos a poder poner en un breakout room. So, por favor, pon un chat si quiere oírlo en español. Gracias.
Ok. So, para repetirles, si quieren escuchar la presentación en español, habrá otro cuarto en donde Giancarlo les puede dar la presentación en español. ¿Ok? Díganlo en el chat, pongan que ustedes quieren en español y entonces los llevarán allí. Si todos quieren estar en este cuarto para que todos podamos conversar juntos, estaremos aquí. Entonces quédense aquí y cualquier cosita que necesitan una traducción, pónganlo en el chat y entonces yo hago una pausa para que Giancarlo les pueda hacer la presentación si quieren. Entonces todo es así. Okay. So back to English. How are you, everybody? So the navigation program is a federally funded program. We have been funded by the federal government since OE1, since the Affordable Care Act came into play. Initially, there were 3 funders within the state of Florida, and we were one of them. We were the nonprofit within the state of Florida. The other larger entity is the University of South Florida, whom we are now affiliated with. And so you understand that this is a grant-based, federally funded program. We do not make commissions. We do not represent one issuer or provider company. What we do is we are here for the consumer, for the community. We are here to educate and to provide and guide the consumer in being able to acquire health insurance through the marketplace. Okay. The marketplace also provides no cost assistance to consumers. So we are free, we are unbiased, and we want to make sure that you are looking for affordable health coverage. As I stated, what are navigators? We are certified and trained to provide unbiased assistance. What does that mean? We have to pass a certification. We are licensed through the state of Florida. We do get a background check. So this is to ensure that you are getting the proper information. Okay, we help consumers understand their health coverage options, and we assist in enrolling in the coverage. So basically, as you all know, with the pandemic, a lot of things have turned into being virtual. We do have some locations that are in person. So if you prefer to have an in-person, we do have basic COVID protections in place, in which your navigators will have, they have a guard, and we do provide, require masks to be worn so that we keep everybody safe. But we have been going back to having in-person navigation, but if you prefer over the phone, that can happen too. All of the locations that we have an in-person navigator, that you can actually select for it to be by phone. You don't have to go in person. And we do have virtual navigators that have a virtual schedule online, and you will learn a little bit about that later on. But I wanted to let you know that navigators, we are here year-round to help you all year long. So what is required for you to be eligible, for you to apply for the Marketplace, Affordable Care Act Marketplace application? You need to live in the United States. And basically for us, you need to live in Florida. You need to be lawfully present. Now, lawfully present does not mean you have to be a resident or a citizen. It means that you just have to have a lawful status. Okay, so I want that to be very clear. What you cannot be is incarcerated, for obvious reasons, but you cannot be incarcerated, but you do have to be lawfully present. So I want to make sure that everybody understands that lawfully present could be a work permit. Lawfully present can mean many different things. So as long as you are lawfully present in the United States, you qualify to apply for coverage. Now, income does come into play, so I do want to make that clear. But if you do not qualify for the marketplace, rest assured that if you come and you see one of us, our navigators, we will make sure that you leave our side with somewhere to go and get health care. We don't want you to leave feeling empty-handed at all. So there are other entities that will help those that do not qualify for the Affordable Care Act Marketplace coverage. And that's what we make sure to give you that referral, so that you go to a place where you may be able to at least get primary preventive care to ensure that you are healthy. Okay, so just make sure that, if you don't qualify for the marketplace, we will send you somewhere that can help you. Okay, so open enrollment is right now. It started November 1st, 2021. And this year, we have an extension. Usually open enrollment ends December 15th, so it would be ending next Wednesday, but that's not the case this year. This year, we have it extended to January 15th. What is important to note is that if you want your coverage to begin January 1st, so if you want your coverage to begin January 1st, 2022, you do have to get that application, and you do have to finalize your enrollment by 11:59. And please don't wait until 11:59, because what happens is that the system gets overloaded. So there's other things that have to come in play, but you do have until 11:59 p.m. December 15th to get that application and to finalize your enrollment. And your coverage will start January 1st, 2022. If you are at 12.00.01 second into 12:16, that automatically pushes your start date of enrollment to February 1st. So I want that to be clear. So if you want your start date to begin, your coverage to begin January 1st, you're happy and go lucky, and that new year is going to start and you're going to have that enrollment, you need to get that application, not only just the application, but you have to finalize your enrollment by 11:59 December 15th. So like I said, we have multiple navigators all across the Southeast Florida. We have enough appointments to fulfill for everybody that wants to call. So please get your application in before December 15th. That way you ensure that your start date is January 1st. And if by any chance, for any reason at all, you find yourself in a predicament where you cannot do it, there is no worry. This year, you can continue to enroll. Just note that your start date will be February 1st. Okay? Once open enrollment ends on January 15th, we go into what is called a special enrollment period. And the first special enrollment period is tax season. A lot of people encounter some situations, or they realize that, you know, their employment, they leave their employment so they no longer have employment coverage. That would mean that it opens up what is called a special enrollment period. You have to have a certain qualification so that this window opens and allows you to enroll outside of open enrollment. What is that? What would that be? You lose employer coverage. You move, and moving doesn't mean that you move from house A to house C down the street. Moving means you've moved zip codes. Okay? So you may be within the same city, but if you move zip codes, it could possibly open a special enrollment period. You get married, you get divorced, you have a child, your immigration status changes. So now you are not with a work permit, you have residency. So these things, and there's several others, your income may change exponentially. So before you didn't qualify, and now you would qualify based on your income level. So all of these things will qualify you for what is called a special enrollment. So if you feel that, okay, I missed open enrollment, I couldn't do it, rest assured there's special enrollment period throughout the entire year where you may qualify and you will be able to get coverage then. Okay, so don't think that you can't. Always call us, ask the questions, and we will let you know if you do or if you don't. So what we ask that you bring to your appointment. So what we do is through a website called healthcare.gov. So we want to make sure that you have an active email account, because this is what will be your username. Then if you already have an account that, let's just say 2 years ago, you applied and then you got employer-based, or you no longer have coverage for whatever the reasons, but now you want to get back, we can find if you had an account and we can try to reset that password for you if you don't have that information. But please try to keep that information, because you want the continuity that all your applications are in one account. We don't want you to have multiple accounts out there where there's an application here and an application there, because it causes confusion within the system, because the system does try to verify your identity so that everything is streamlined. Okay, we want to know your legal name and date of birth for all of your household members. So it's really important that you understand, even though you may not be applying for coverage for some people in your household, we do have to enter them as part of your household, even though the only person that's looking for coverage is yourself, let's just say, or you may not be looking for coverage, but you're looking for coverage for your spouse and, you know, dependents. So we want to make sure that you understand that you have to bring the legal name and date of birth for all household members, social security numbers for all of who are applying. Okay, so everybody who is applying for coverage, we need their social security number. We need income information for everyone in the household that has income that is going to be on one tax form. So if it's, you know, a parent with 2 children and 2 of the children, you know, the 2 children have a job, we need to know their income. Even though the children may not be applying for coverage, they may have coverage elsewhere through another parent. We do need to have the income of everybody that is on your tax form that you will be declaring as your dependent. Okay, list of your medications. And the reason why we ask that is because we want to make sure that the coverage that you select is one that will cover your medications. Now, I will be honest, sometimes it's a little difficult to find out if the medications are covered or not, but we do our best to knock on all doors that we have to knock on to find out if those medications are covered. Your primary care doctors and your specialists. We want to make sure that you can continue with your care with the doctors that you are comfortable with. We don't want you to have to switch networks. The best way for you to find out what plans your physicians and specialists take is that you call the office of your doctor and you say, can you please tell me which plans off of the Florida Marketplace Exchange? Okay, so the Marketplace Exchange, or what most people call is Obamacare, you want to make sure that you tell them, you know, can you tell me what plans you accept? And they will tell you the plans that they accept from the Marketplace Exchange. Your preferred hospitals, not everybody, not all hospitals are in network. So you need to have that clear on which hospitals you prefer. That way we try to, you know, we will show you the plans that include those hospitals that you prefer. And if you have a plan now or you just lost a plan, so let's say you had employer-based, bring with you that information. What did that plan cover? What was your deductible in that plan? What were your expenses, you know, your co-pays and your co-insurances? So that way we can compare apples to apples, or maybe something even better off of the marketplace. So financial assistance, or what we call the tax credit. Okay, the financial assistance is what it's based on. It's based on your household size and income. So when you apply, we input how many people are in your household. So basically who is on your tax return, and we ask you your income. The application does its math, and then it calculates how much of a tax credit will be applied to that monthly premium so that it lowers your cost initially. These tax credits then, not to get too technical with you, but when you do your income tax, the marketplace sends you a form and you have to do what is called the reconciliation of those tax credits. But the tax credits lower your premiums and your out of pockets depending on where you fall on the income federal poverty line. Okay, and one of the things that is a requirement, if you apply for coverage on the marketplace, you must file taxes. And one of the things that you also need to understand is if you are married, you must file taxes jointly. If you file taxes married filing separately, it will not give you financial assistance or a tax credit. Okay. Deborah? I do apologize. I'm having a little situation here.
I'm here.
Hi, Deborah. Are you
How you
able
doing?
to see the chat?
I'm sorry?
Are you able to see the chat?
Yes, I am.
If there's questions in there, would you be able to let me know?
Sure.
And read them to me? Thank you.
Sure.
I do
Would you like me to
apologize, guys.
start
I'm
now?
having a little technical and I can't see the chat, so I apologize for that. Thank you, Deborah.
All right. We do have questions in there already.
Can you ask me?
Okay. Well, Christine asked you to make note that Martin County is also a county that we're offering insurance
Oh my God.
assistance.
I totally forgot. I went down the line. I do apologize. And I literally skipped over one. I do apologize, everyone. It is Okeechobee County, Indian River, St. Lucie, Martin County. Then it's Palm Beach, Broward. I knew I was forgetting something. That's why I paused. I do apologize. Palm Beach County, Broward, Miami-Dade, and Monroe County. So I do apologize for that.
All right. And someone else asked for the phone number so they could call in for Spanish speakers. But wasn't that a separate
Absolutely.
registration?
When you call in 877-553-7453, we do have bilingual representatives answering the phones. So they will be able to make an appointment because we do have bilingual, like Giancarlo had said earlier, we have navigators that speak Creole, Haitian Creole, we have navigators that speak Spanish, and we have navigators that speak English. So if you need assistance in any of those three languages, oh, I do apologize. We do have a navigator that speaks Portuguese. So if you need assistance in any of those languages, please ask that you are looking for a navigator that speaks Portuguese, and we can be, they're able to make an appointment for you for that navigator.
I actually see Giancarlo answered that question. Let's go on. We have from Karen Burke. My temporary job is likely ending at the end of March. I currently have health insurance through my employer, but it'll be ending too. But I need to enroll by the deadline. And I think you answered that question when you spoke about the
Correct.
special enrollment period.
Yes, so when
And
you're.
Giancarlo answered that as well.
Right. So as long
Okay.
as you, if your employment is going to end in your coverage, make sure that you understand what the last day of your employment is. Because if they say your employment, the last day of your employment is March 30th, you want to get that application in by March 15th so that your coverage will start April 1st. Okay?
Okay, and there was another question. I have insurance through my job, but it's very expensive. We just moved. What are the qualification criteria? And Christine answered that question. Unless your employer's insurance does not fit the Obamacare definition of affordability, you must take the employer's insurance. Okay. And the last question was, how does it work with college students without parents? That's
Okay.
the last question. That question hadn't been answered yet.
All right. So college
Mhm.
students, that's a great question. So college students, if you are getting any type of Pell Grants or any type of grants, that can be used as a type of income, but it may not qualify you to get tax credit. So it is on a case by case, and we would have to speak with you. So please give us a call, make an appointment, because we will try to help you in any way possible. But college students, it is a fine line that we have to look at, and then we have to take it by a case basis. Okay? So moving right along. How to make appointments. So as I stated, this is our number. If you prefer email, as many people do, you can email us at this email address, which is healthenrollinfo@epilepsyfl.org. So let me say that again. If you prefer email instead of calling us to make an appointment, of course, if you want to make an appointment by phone, 877-553-7453, or you can email us at healthenrollinfo@epilepsyfl.org. So let's open it up for questions and answers.
I actually have a question, Shirley. Is it possible for someone, let's say my job offers health insurance, but I want insurance from the marketplace. Is it possible to choose marketplace over employer insurance?
As Christine stated and I'll elaborate a little bit further, there is a table that we use to calculate if your employer-based coverage is not affordable. And that percentage is that it has to be over a 9.63. And if Greg is on the call, I know he's going to correct me, percent. So the rule is if you are offered employer-based coverage, you are to take employer-based coverage. Now that is for the employee only. It does not take into account how much it costs you if you add your family or your spouse, or it's the employee plus children or employee plus spouse or a family group. It is only looking at what is the cost of the employee and how much the employee has to pay out of their paycheck for that coverage. So, if your coverage for you alone is below that 9% that I said, then you are obligated to take your employer-based coverage. If you are above that number, then you know, we have a chance that we can actually get you coverage through the marketplace. But it is something that we have to calculate before we can say yay or nay.
Perfect. Thank you so much.
Okay,
Any
and
other
Christine
questions?
reiterated, if the cost of employees coverage is more than 9.6% of the household income, it is considered unaffordable.
Correct. I thought it was, yeah. Thank you, Deborah,
Mhm.
because I wasn't sure of that percentage.
Mhm.
So it is 9.6%. So if you're for the employee only, if it's more than 9.6%, then it is considered unaffordable, and then you can go to the marketplace. If it's below that 9.6%, then you have to take the rule is that you have to take the employer based. Any other questions? Anyone? So again, 877-553-7453. If you prefer email, it's health, that is HEALTHENROLLINFO at epilepsyfl.org. And we will respond to your email immediately. Yes, anybody have a question? I thought I had heard something.
Nothing else in chat at this time.
Is there anything else in the chat?
Nothing in the chat, no.
Actually, it's 9.5, not 9.6.
It went down a point. So it's 9.5, everybody. You know, it's funny, things do change year to year. A lot of the times, you know, because of administration purposes, it changes also. So we do have to constantly be looking, and we do webinars, and we are, you know, reading up on the changes, and we assist because we want to make sure that we're able to provide you the latest information and the best possible service that we can possibly give. Now, I do want to mention, since we're here, one of the things that Navigators do is we provide a lot of health literacy while we're sitting with you, and also we do workshops everywhere. In every county, we will be starting to do workshops on health literacy. What is health literacy? You may not think that you need health literacy, but quite honestly, during COVID, it's been very noted on the lack of health literacy most of the population has. So we do these workshops, and where we explain how, you know, sometimes your doctors should be communicating with you, or you should be able to communicate with your doctor. Sometimes, you know, you go to the doctor's office, and you come home, and somebody asks you from home, well, what did the doctor say? And they're like, oh, you know, they said, you know, this and that, and then they told me I have to take some medication, but you really didn't grasp and understand what the doctor was telling you. So we try to guide you and educate you in asking the questions that you should ask, and maybe having the staff at the doctor's office, or the physician themselves, or the nurse, to repeat things to you. And we also go into you understanding your health insurance. I've dealt with white collar executives all the way down to, you know, a labor worker, or, you know, myself. And most people don't understand how to utilize their insurance, or understand what the financial implications of your insurance are, whether it's employer-based, whether it's Medicare, whether it's Medicaid, you know, whatever it is, or it's Obamacare or the marketplace plan. They don't understand how to utilize it, and what the financial obligations are if you have a deductible, if you don't, what your copays are. Sometimes people don't understand what a coinsurance is. And all these words that I'm spewing out there are key words that you need to really understand when you have health insurance so that you utilize your health insurance to the maximum of the ability with the least amount of cost to your pocket. So that's what we try to do, is make sure that we educate you so that you have a basic understanding. We don't expect everybody to be experts. We're learning every day something new, but we do want everybody to feel comfortable enough that you can go to your physician. And a lot of the times it's culturally based, because at least in my culture, doctors are very much respected and regarded. So you don't question them as much, but sometimes you have to question, and sometimes you need a second opinion, and sometimes you need to say no, so you need to be able to communicate this in a manner in which you are understanding what they're saying, and it's not technical jargon or you're just intimidated by the whole process in any way. So if anybody is interested for our health literacy workshops, again, call this number or email the health enroll info, and we will definitely get with you and try to see if you have more, a group that we can gather, and we will give you that health literacy workshop also. So understand that navigators aren't just here just to enroll you and that's it. We are here year round to answer your questions. If you have a difficulty, if something's going wrong with your health insurance, if you just don't understand why you're being questioned about or you're being charged something, we are here to answer those questions throughout the year. If you find yourself in a pickle with your insurance through the marketplace, we will help you do your appeal. There are ways that you can appeal either the insurance company or you can appeal the marketplace if something has gone wrong. So please don't think that it's a dead-end street. It's never a dead-end street. Until we have exhausted all the avenues, it's never a dead-end street. So if you have questions, if you don't understand, how your policy works, again, we have those health literacy workshops that we can help you with. And if you have questions about your health insurance, give us a call and we will help you with that too. Anything else? No questions? Any good stories out there? Anyone in the chat?
Greg just posted something. Greg, you want to share this yourself?
Greg is our lead navigator, but Greg, along with, we have two others on our team, our director, and we have one of our Creole speakers, Greg, Natalie, and Islada. So I'm mentioning this so that you understand the experience that you have about our program. Our program, we have a lot of experience, and Greg is one of the original navigators. He has been here and he's been doing this since the Affordable Care Act started. So Greg, I see that Deborah's mentioning that you posted something in the chat. If you would please unmute yourself and you can elaborate on what you posted.
Yes, it's a hypothetical question, and I'll state it. I am not lawfully present in this country, but my spouse and 3 children are citizens. I am the only one employed and earning $41,000 per year. I would like to know if I can obtain insurance for them.
And the answer is yes. The answer is yes.
Thank you.
So if you have a mixed family where there are some with lawfully present and some that do not, we have to enter everybody's income into the application, but that doesn't mean that we are requesting coverage for everybody on the application. So yes, in this hypothetical situation that Greg has mentioned, we can do the application, okay? And we will say that adult A is not requesting coverage, but adult B and children C, D, and E are asking for coverage, and we include his income that would cover the whole family. Now, again, it's a family of 5, So therefore, they have to meet the federal poverty line for the family of 5 for them to qualify for tax credits.
Now, even though I'd like to obtain coverage for my hypothetical family, I am not lawfully present, and I'm concerned about providing details about myself and whether or not I would be jeopardizing my presence in the United States.
Mm-hmm.
If you are not lawfully present, we do not have to put your information in. The only thing that we do have to provide is your income. But
That's good.
It will not ask for coverage because we will do it under adult B, children. And then when their question is asked, are you married? You say yes, and then you provide a name. And that's pretty much all you really have to do, because that other person is not asking for coverage. And therefore, you don't have to enter a social security number or any type of immigration information for that person that is not asking for coverage. You only have to really enter for those that are.
So basically, my situation will not be reported to the government.
Well, that's not what happens with tax reconciliation.
Correct. So
Okay.
that all happens, that all takes into effect with the tax reconciliation, in which at the end of the year of your coverage, you will receive what is called a 1095-A form. And then adult B has to go file taxes. And again, adult B will say they are married, and adult B will say, you know, that I am married, but they don't have to report because this person is not doing it. Now, usually in a mixed kind of situation, many people get what is called an EIN number. So they start paying taxes even though they are not lawfully present. And this is something that is completely legal, and it's actually good to do because it shows that you are, although you don't have legal standings, you are paying taxes to the government on your income.
Okay,
Okay, thank you.
very good. Mhm.
Any other questions? Stories?
Christine has a comment. Christine?
For some people, the American Rescue Plan might make subsidies possible where they were not possible for them before. If you're just above the 400% federal poverty line, you now might qualify for a subsidy where you did not before.
Okay.
There
True.
are other things about the American Rescue Plan, and all these will expire at the end of 2022.
So that is something great to mention, Christine. Thank you. The American Rescue Plan, which started March of this year, has really provided more opportunities for people, consumers, to be able to qualify for coverage that before were sort of above the income level or to below the income level. So please take into account, and these will expire, as Christine said, they will expire at the end of 2022. So you may not have qualified before. Please don't think that you may not qualify now. You may qualify for 2022. And whether you qualify for a year, you qualify for 6 months, I think anytime that you can qualify to get health insurance and you can get yourself checked out is really important, because it does save lives. Preventive care saves lives. Having the ability to go to the physician and get yourself checked out saves lives. So, you know, if anything, you know, you may want to give it a try again. And if it doesn't work out, it doesn't work out. If it's not something for you, then, you know, you're not obligated to enroll. You're not obligated to say yes. You can, at the end of the day, you can cancel the application. You don't have to, you know, follow through with anything. So just give it a try. Don't assume that it doesn't work until you call us and we do an application for you. Any other questions?
Nothing in chat.
Anyone? I wonder how they're doing in the other room, in the Spanish room. So we do have another little breakout room where those that wanted to hear this presentation in Spanish. So we're hoping that everybody is enjoying this presentation. Again, please give us a call at 877-553-7453, or you can email us at healthenrollinfo@epilepsyfl.org. And we will be more than happy to get back with you and answer your questions and hopefully get you enrolled during this open enrollment period. Understand that there are many factors that go into play. So you may have done this a long time ago, things have changed. So please give us a call and see if you qualify this time around. And again, if you're interested in the health literacy, you may not, think that, but maybe at your work, there are several people that want to understand the type of coverage you have through your employer, or, they have the marketplace coverage and they're really not understanding, or something happened where you were charged a fee that you may not think that you should have been charged. Please give us a call. If you're interested with that health literacy, we can also do, schedule a workshop for you. Any other questions or stories that we want to hear? I was thinking of when I first started, this was all pretty brand new to everybody. And, a lot of people, I personally don't like to use that word Obamacare because it puts a little political connotation to it. So I like to say the marketplace coverage. And it was really remarkable when I started navigating to see how many people could not or did not or never had coverage, and then all of a sudden they qualified to have coverage, on the difference it made in their life. So I think that, without putting it with its political connotation, because most people like to call it Obamacare, I think that everybody should just give it a try. And if it doesn't work out for you, it doesn't. But you may have a neighbor. This may not be something for you, but you may have a neighbor. You may have a coworker that does not qualify or is not a full-time employee that you feel may need to give us a call and find out if they can get coverage through this. You may have a neighbor. You may run into somebody in the street and you're paying it forward. So, in this time that we have been living in these last 2 years, I think that our humanity has grown, and we want to take care of each other, and we want to make sure that everybody is safe and is healthy. So this is something that we can do. And again, like I said before, there are qualified health clinics that we will refer you to if you don't qualify for the marketplace. There are these free clinics that we can find for you. Sometimes there are clinics that will charge based on a sliding scale. Again, all of these things, we will never let you leave our side without you leaving with something in hand that will provide you a place for you to try and get medical care, at least for primary care. So we really want to make sure that we hone that in, and we push that information that it's not just about the marketplace application, it's about getting you coverage. So please give us a call if you have any questions, 877-553-7453. or email us at healthenrollinfo@epilepsyfl.org and ask the questions that you need. You will get as best the answers that we can possibly give, or we will refer you to where you need to go. And rest assured that we will try to do our best to get you the health coverage that you need.
All right, and Chris would like to offer thanks for you sharing this information.
Thank you, Chris, for joining us, and I hope that you enjoyed and that you received some sort of information and education today. That is our goal, that you leave knowing something new. If anybody has a question on, the insurance or what their coverage is, please ask. But that is our goal, is that you leave a little bit more educated about all of this than when you arrived, and hopefully you can pay it forward and share the information, and somebody may need the coverage more than you know. Anybody else?